At the El Paso County Department of Human Services, our first priority is to protect children. The protection process begins with the Child Abuse and Neglect Hotline, where the public makes reports.
Child abuse reporting.
We take the phone calls, take the information, have a script that the screeners are asking each caller to better help us make decisions on assignments. And then we research it with various pieces just to help us, again, better make a decision on whether it's going to be assigned.
In 2011, El Paso County received 12,327 reports of child abuse or neglect, by far the most in the state. 3 times a day, there are red team meetings where child protection supervisors, individuals from other DHS departments, and representatives from our community partners review all the reports and decide as a team if caseworkers need to follow up immediately, in 3 days, in 5 business days, and if there are specific referrals to community programs that could be made to help support that family.
It's a group process decision now where it looks at a bigger picture about family strengths, family's needs, the history, what risk and safety issues are, as well as what information maybe we need to clarify before we make a response to the family.
Caseworkers go out and investigate about 50% of the reports to the hotline. The determination of whether a report will be assigned for investigation is based on the definitions for abuse and neglect outlined in the Colorado Children's Code.
It is the guideline that we have to follow as a department on our intervention with families. So it's kind of like our playbook. It tells us what we can do, it tells us what we can't do, it helps us understand what types of interventions are available, and what our authority really is.
According to the Colorado Children's Code, a caseworker is required to talk to the alleged victim of abuse without the perpetrator, who could be a parent, in the room. Caseworkers do this and talk with the parents or alleged perpetrator as well as anyone else they feel can contribute to the investigation.
Talking to them without that person present gives us a better chance of getting the whole story in a child to tell us what's going on, rather than have that perpetrator in the room and the child feel like they can't talk freely about what's happening.
Often caseworkers go to the home by themselves. If they are concerned for their safety, they can get an escort. But there is an anxiety involved with any home visit.
There have been times where we've gone out to the home and we've had a perpetrator in the home, a domestic violence perpetrator in the home, who's gotten quite loud and yelling and angry, and at that point you just kind of have to, excuse yourself, get out of the situation, make sure that you stay safe.
Not only do caseworkers have to effectively handle extremely volatile situations, but they are exposed to some of the most disgusting living conditions in our community.
Animal feces or cat urine or hoarding type things. And I went out with another caseworker on one where we got out of the car and you can actually smell the cat urine from the street.
Depending on what the caseworker discovers on their initial assessment of the report, there are several possible outcomes. 1, no evidence of abuse or neglect were found, but the caseworker may refer the family to community partners like mental health, military, or domestic violence services. 2, open a voluntary case with the family where they agree to some level of services from DHS. 3, get a court order for mandatory services and provide a treatment plan for the family. 4, remove the children. Removing children from a home is always the last resort.
The caseworkers that we have in our department really believe that families need to be together and that kids deserve to be with families and they deserve to be safe as well. And so they will bend over backwards to work with a family to try and make sure that that child is safe with those parents. And if that child can't be safe with those parents, that they look for the next best thing for those kids, because that's what all children deserve. That's what I would want for my child.
If it is determined a child needs to be removed from a home for their safety, the caseworker works with a county attorney and receives a court order for removal. An effort is first made to place the child with an appropriate relative or close family friend.
It's better when youth that have to go into care know the people that they're being placed with, so that's where there's less of a shock. It's something that the family knows them and they know the family, so they'll be more comfortable and it'll just be an easier transition.
If that doesn't work, the children are placed in foster care. In El Paso County, we contract with 9 child placement agencies who offer foster home placements for the children and casework services for the entire family.
By contracting out services, we have an opportunity to expand our workforce, and we have an opportunity also to have agencies specialize and provide more specialized foster homes and more specialized casework for situations where our youth might be more difficult to place in a regular county home.
El Paso is the only county in Colorado that uses private agencies for placement and casework. An average of 560 children are in foster or kinship care on any given day in El Paso County. If possible, the goal is still to return the children to their parents as quickly as is safely possible.
We'd like to make any episode of out-of-home care as quick as possible to reunify back with the parents or back with the party that they were removed from. But generally, what we've seen is anywhere from 3 months to sometimes a year or a little bit over a year, depending on how ready the parents are or the parties that they were removed from are to take them back into their home safely and to be successful.
When children are removed from parental custody, supervised visits are often part of a family's plan, and many of those take place at the Family Visitation Center run by the Department of Human Services.
We're ensuring safety for children, both physically and emotionally. We are assessing and trying to heal damaged relationships, and we're trying to teach better parenting skills by mentoring and coaching and modeling good parenting for parents.
If families successfully follow their treatment plan and it is deemed safe for the children to be returned home, that will occur. If it is determined parental rights should be terminated, the children are then available for adoption.
The decision to terminate parental rights is never an easy one, and typically happens after multiple attempts to re-engage the parents to complete treatment plans and complete things that we would need in order for them to be safe for their youth to return to back into their home.
But it's not just children in our community that need protection. The Department of Human Services is also responsible for investigating allegations of abuse and neglect of at-risk adults who are 18 or older.
So Adult Protection receives the reports, we do our investigation, we determine whether or not resources need to be placed into the home to help the person maintain at home, or maybe they need nursing home or assisted living placement, applying for benefits, those type of things. And then also proceeding towards probate court for guardianship or conservatorship for the person.
In 2011 in El Paso County, there were more than 1,000 reports made to Adult Protection.
We accept referrals for abuse, neglect, and exploitation. Exploitation can either mean financial or otherwise.
And the reports of abuse and neglect could increase as the population of those 60 and older is dramatically increasing in El Paso County.
In 2000, we had approximately 49,000 seniors in El Paso County, and in 2009, we were about 80,000. And in 20 years, we're going to be about 185,000 seniors.
At the Department of Human Services, we count on the public to be our eyes and ears in the community and greatly appreciate calls to our hotline if you see something that does not look right. If you suspect child abuse or neglect, please call our hotline at 444-5700. And if you suspect abuse or neglect of an at-risk adult, please call 444-5755. As a reporter, your identity is always confidential. DHS is responsible for the administration of federal and state economic assistance for needy families. These programs and services are established at the state and federal level, and counties are required to deliver these benefits efficiently while promoting self-sufficiency. Food assistance is one such program. In 2011, on average, each month, more than 62,000 people in El Paso County received benefits through the food assistance program. That is 10% of the population in El Paso County.
The food assistance program is a federally mandated program to supplement the food needs of individuals within our community based off their income guidelines. For a household of 4, you'd be eligible with $2,400 gross income, so that's before taxes.
All the funding for food assistance comes from the federal government. DHS is responsible for screening to determine eligibility and ongoing monitoring to make sure the eligibility standards are met.
Most households recertify every 6 months, so then they would get paperwork at the 6-month time period after they've applied, and then they have to recertify to see if they're still eligible for the program.
The federal government requires timely delivery of food assistance services.
So the federal requirement for food assistance for expedited is 7 days. So in 7 days, when that person applies, we have 7 calendar days, not business days, to provide them benefits on their card. For regular food assistance, we have 30 days.
The number of people receiving food assistance is tied directly to the economy. From 2008 to 2011, El Paso County DHS workers saw a 74% increase in the number of people receiving food assistance.
The biggest thing that we've done over the last 4 years is really look at our business process. So we've really re-engineered our way of doing business to be able to accommodate the demand.
When a person applies for food assistance, the application is put into the statewide computer database, and a DHS technician schedules an appointment to meet with the applicant. When all the information is in order and complete, the client can walk away with benefits that same day.
Nowadays, with the volume being so high, we have the margin of error for us is so little. So in other words, if like in our recertification process, if we're back a day or two on our issuance cycle, then people are swarming our lobbies or swarming our phones. I mean, they're calling the media, and it's just, there's an impact. And so it really causes us to really have to look at everything that we're doing each month. It doesn't stop. It's the same cycle each month that we have to be processing at a certain level in order to meet the needs of the families in the community. A lot of people are depending on us.
Benefits are shown as credits on a Quest card, which is used much like a debit card, except that it is restricted to food items only. The goal of the food assistance program is to help with the basic nutritional needs of qualified applicants. Monetary assistance is also distributed through El Paso County DHS through a program called Temporary Assistance for Needy Families, also known as TANF.
It's designed to help families become self-sufficient via employment. It is a grant-based program based on eligibility, so families receive a monthly grant, and they also receive assistance with childcare, and they receive assistance with training and education to help them find employment.
TANF recipients are subject to very strict qualification requirements.
You have to meet certain income guidelines and criteria. You have to be responsible for a dependent child, and you have to be lawfully present.
The money distributed comes primarily from the federal government. DHS is required to administer the benefits and maintain tracking to ensure families are completing required work participation activities.
It could be that someone needs their GED or their high school diploma. It could be that someone needs training or retraining for a specific career. Anything from maybe becoming a CNA to short-term training for automotive. Whatever that particular person's goals are, we can provide that level of training.
In some cases, one-time or limited financial assistance is enough to get people back on their feet. This can come from the state diversion program.
Provides flexible assistance for people who are job ready and provides them some financial support so that they can find employment within that 2-month period of time.
Frequently, the availability of good child care is the key to helping a family attain self-sufficiency.
Good child care is critical for these parents.
The Colorado Child Care Program, also known as CCAP, is primarily funded by federal dollars and helps families afford quality care. Parents pay a portion of the child care cost based on their income, and the CCAP program pays the rest.
It's for families in the community, again, who meet income guidelines and who are lawfully present, can then apply for child care assistance to help with the cost of child care.
El Paso County DHS is also responsible for the administration of the Family Medicaid program.
Any adult or a couple that has their children under the age of 18 would be eligible for the Family Medicaid program, based also once again off their income.
Eligibility is determined by age category with different income guidelines.
The threshold for Family Medicaid is 100% of the federal poverty level, which for a 3-person household is probably right around $1,500.
Children have health insurance through Medicaid.
Broken arm to, dental work to, whatever that could. I mean, it's pretty much full coverage.
Medicaid also finances long-term care.
It includes nursing home and assisted living, as well as 30-day institutional stay for long-term hospital stays over 30 days. It also includes home and community-based services for in-home type of things such as housekeeper, medical, things to prevent nursing home placement.
Timely processing of these applications is critical.
So if we're not getting applications processed timely, then the nursing home is out of money. And at $6,000 to $7,000 a month, that adds up pretty fast. That puts an undue stress on the client as well as our economy in the local area for nursing homes who have to basically foot that bill until we get the Medicaid process completed.
Clients who provide improper or incorrect documentation to support their eligibility causes most of the delays.
You need to bring in your verifications of income, citizenship, resources, disability are the 4 main things.
There are also several programs at the El Paso County Department of Human Services that go above and beyond to help families achieve self-sufficiency, like the Center on Fathering that is primarily funded through grants.
The services we offer range anywhere from basic information on what it means to be a father to support activities such as a mentoring program and weekly support group to education for fathers. We have a variety of different classes that fathers can participate in that will assist them in better knowing what it means to be a dad and how to respond effectively to the needs of their children.
Employees at DHS also leverage resources in the community to assist clients. One great example of this is our annual Feed the Children event, where through many generous donors in El Paso County, families involved with the Department of Human Services receive food, toiletries, coats, books, and toys, and a day of celebration right before Christmas.
I've traveled 60 countries and probably almost every major city in the U.S., working particularly in urban areas, and I've never seen this level of cooperation take place.
The employees at DHS work tirelessly to get all clients the assistance they need as efficiently as possible and are constantly looking at ways to make our system even better.